God tells you what you are. And He created us as a beautiful, created being, unique, not like another woman, but women in general, we're powerful. And He designed us to use that power to help our mates, to mother our children, to be daughters, to be sisters, to be friends. He gave us all that power to do those things. So we shouldn't see ourselves as less.
I am Alisha Payne with the Woman Up Nation, here to elevate, educate, and empower women all across the world to walk in their purpose, to live in their passion, and to operate in power. We are discussing all things that impact and improve the lives of women, from health to wealth, from fun to faith, from family to future, and every single thing in between. And I do mean everything in between. Our month of February is dedicated to love, loving ourselves, loving our spouses or partners, loving our peace, and loving our womb manhood. I say that again, womb manhood, WOMB manhood. Everything that makes us a woman, loving that. We have an expert today to help us navigate our womanhood in all different stages of life. Welcome, Dr. Lisa Cardwell. Welcome to the Woman Up Nation podcast, Dr. Lisa. Is it
Good
okay for me to
morning.
call you Dr. Lisa?
That's perfect. Thank you so much. And thanks for having me.
Oh, I'm so excited to have you on today. Dr. Lisa is a dedicated women's health professional committed to providing high quality care in the Detroit metropolitan area for over 30 years. Over 30 years? Is that right?
Yes, that's right.
You
That's
look
correct.
you you look 30. And you focus on gynecology only.
Yes, yes,
Okay. And
I
I know
do.
that you have a wealth of experience to bring us today. I know that you also offer treatment in fibroids,
Yes,
endometriosis,
yes,
menopause, and
of
minimally
course.
invasive robotic surgery. You
Yes.
have been doing some amazing things in the Detroit area, Dr. Lisa.
God has blessed me in this area. Um, I felt like they needed me and I needed them. He's just blessed
Mm.
me to be able to do so.
So
Mm.
let me ask you this: what made you as a child? And I like to go
Okay.
back to people's childhood. What made you as a child think I want to become a doctor? Because we've all said it to make our parents proud. We'll be a doctor. We'll be a lawyer. We'll be an architect. But you made that dream a reality. What was in you as a child to make you want to become a doctor?
I just think because I was inquisitive and curious and just wanted to know how things work. I wanted to know
Hmm.
how the body worked. So I've always wanted to become a doctor. I'm pretty sure that I hung on to that, as well as some other things. But the doctor realm, that really just rang true to me. And
Yeah.
I decided to be a candy striper. And you guys might not know what a
Yeah.
candy striper is, but
Educate us, Dr. Lisa. Educate
it,
us.
it's a little, when you're young or a teen, you can volunteer at the hospital and you work on different floors. Back then, we used to pass out magazines and just visit
Hmm.
with the patients to make them feel comfortable. So, just, God sent one nurse to me, and she said, "Do you want to see a baby be born?" I was like,
Really?
"Yes."
As a
I'm
candy
telling you,
striper?
yeah, as a candy striper in the seventh grade. And from that moment on, I was hooked. I didn't feel sick. I didn't feel nauseous. I didn't pass out. I
Wow.
was amazed. And from that point on, I knew I wanted to do obstetrics and gynecology. And I still tried to have an open mind in medical school, like what area did I want to serve in?
Right.
And that just always was my heart. And
Wow.
I did that for the last 30 years or so, and I just retired from the obstetrical part, which is
Hmm.
delivering babies, about
Yes,
five
ma'am.
years ago.
Yes.
It's about 5 years ago.
Why? I don't think I ever heard a
Yeah,
person say that in the seventh grade they watched the baby being
I'm
born.
telling you. I just don't even know. I mean, we know why. It was the Holy
Yes.
Spirit that drew her to me, but I I just don't even know. Maybe she just could see that I was curious, wanted to know things, and she was just willing to show me things. And I loved it.
So
So
a
yeah.
curious no, it didn't start out of curiosity. It started out of you serving. You know, candy stripers.
Yes,
You're volunteering. You're not
exactly.
getting paid, but
Yeah.
the wealth of experience that you can gain. I just don't know if a candy striper actually have. And I knew candy stripers back in my time.
Right.
I don't ever remember them saying that they had that experience that you had.
I can't believe it. And she asked me. I said yes immediately and hooked
You
from that
want
time.
were you this because that thing would have blew my mind. And then from
Right.
watching a baby being born at that age would have blew my mind.
Yes, and it just right then, from that point on, I knew what I wanted to do, and God allowed it to happen, and I'm just thankful. It was a blessing. Now,
Yeah.
delivering babies over time, it wears on you. You're up at any time. They come, they have no respect for your time, these babies,
No.
and our lives are devoted to them. So, so actually, after a certain age, you may, slow down or get tired, and
Right. Hmm.
I have, but I did it in this area for 30 years. So I've been
Seeing
practicing for
life.
over 30 years. Yes.
Wow, seeing life being brought into this world. So then you know how intricately and incredible a woman's body is
Oh,
fashioned and designed. And,
right.
you know, sometimes we look at our bodies and we don't like what we see. But
Mhm.
I always think of our bodies as works of art created by God. Tell me about what you think.
I know they are. And when
Hmm.
you think about just even that, the ability to give birth
Yeah,
and to come back from that and appear normal is just crazy. So God designed it. He said that people are without excuse, knowing that God,
yes,
because even in that, seeing that somebody can actually, out of this small area, allow a whole human being pass
that
through.
is,
It's
wow.
just amazing in itself. Also, that um, a tiny human being can form and bloom and grow, and that's the only nourishment that they have. God gives you everything you need to
Wow.
feed that baby while um, it's inside. So just all those things are just amazing, and they really couldn't come about any other way. Um,
Yeah.
and I was saying that we were different. We are different than animals. They can have a bunch of babies, nourish them and drop them out and
Right.
just for a certain amount of time. But God gave us in something more special than animals in what we can do with our offspring, how we can rear them and raise them and uh,
Mm-hmm.
help them become productive citizens. God, that's a special calling that God has on your life to be able to have
As a
children.
woman.
Oh, yes.
Right.
Yes.
Right. That's beautifully said,
Hmm.
you know, because sometimes we just think about, okay, our bodies and we are able to do these things, but we don't
It's
see the miracle in it all. You
cool.
know,
Hmm.
God has to have a hand in who we are and how He formed us. You think about all the, and you can speak more of this than I can, but all the systems in a human body that makes up the human body. I can think of a couple, you know, not just systems, but things within us, our atoms, our cells, organs, and things of that nature. But to know it to a different degree, a level of expertise that you have, that to me is just fascinating. Fascinating to me.
It is. And those are the types of things that interest me, and that I'm sure God put that in me and directed me towards this area. Um, it's
Yeah.
just blows your mind what he has created, and it lets you know that it could have come about no other way. No
No
other.
other way.
Mhm.
To God be the glory,
Yeah.
right?
Yes, yes, yes.
Why do you think, with all of that being said,
Mhm.
how beautifully crafted our bodies are and they're works of art only created by a God of the universe, why do you think that we have like this disconnect as women? Like, I'm gonna throw this out there. It may sound strange, but a
Make it up.
disconnect with our vaginas. Like,
Hmm.
we don't embrace it. I'm gonna be honest. I'll just say it. I think I was in my 30s before I ever really even looked at my
You're
this
right.
miracle.
Right.
Because it was. I don't know if I connected. It's a weird disconnect. I'll say.
I'm pretty sure that it has much to do with our upbringing, our
Okay.
culture, our society. Um, Now we can see that society embraces all these things and
Yes, ma'am.
tries to normalize it, and it also encourages you to know your body, to know your vagina.
Right.
Whereas as children, you might have been brought up in a culture or a home that
Yeah.
shunned that. You shouldn't look at yourself. You shouldn't touch yourself. You
Right.
shouldn't, and all of those things made it be something that was shameful or bad.
Right.
And so therefore, we bring all those things over into our adult lives, and
Yeah.
we think we shouldn't look. Pretty much, to know that something's wrong with you, you have to know what your normal looks like. You have to.
R-
How would you
Absolutely.
know it's something different or something wrong? We should encourage our children, our young people to know their bodies and
Mhm.
know them as they're growing up so that they can see the changes and know what is normal, what's not, what's different.
Mhm.
Um, we always want to hide something in the vaginal area, but I liken that to also our minds. We also culturally don't accept that things can be wrong with our minds or our brains.
Oh wow, that's deep.
And just as if anything can go wrong, like I say, if I could have diabetes, that's because my pancreas doesn't make enough insulin or
Mhm.
something is going on with my body that I don't react to insulin correctly. Why can't something go wrong in my mind or my brain where I'm not
Right.
producing enough of um, dopamine or
Yes, ma'am.
whatever is needed to keep me at an even keel? Less of that
Yes.
may make me depressed. These are true things that can go awry or go wrong with our bodies that you need to address. And it shouldn't be more shameful to address the vagina or the mind as it is the kidney.
Mm.
So
Mm.
we have to take care of all of us.
Yeah.
God gave
Oh, I
all.
like how you put that, because
Mhm.
it was a stigma, and I
Yes,
can speak for
yes,
my own childhood. Had the most incredible mother in the world,
yes.
but there was a different age where
Right.
you didn't talk about sex. You know
Mhm.
what my sex education was? I wish you would go out there. Was for all my brothers and sisters.
For
I wish
me
you
too.
would call yourself trying to go out there and do nasty things. I will kill
Right.
you. And so
Right.
that kept me, that threat kept me almost pure till I got married. I said almost pure, but you
Right.
know what I mean? I still was a virgin,
Exactly.
but you know what I mean? That kind of
Exactly.
mindset was like, and so you thought of your parts,
Hmm.
your womanhood, the things that you should have
Right.
been
Yes.
embracing, as something
Yes.
bad or something nasty, or
It's
you
not.
knew that the quote unquote the fast girls are out there doing it. You
Yes.
better not do it. And so, but I'm glad that this generation is embracing
Right.
being a woman and knowing their bodies more so than
Mhm.
we did. But it's
Right.
never too late to learn, is it?
It's not too late. It's not too late. And we should. And even and you have to learn, or you
Mm-hmm.
won't be able to deal with the things that happens to you as we age, different
Right.
things, different stages of our lives, things are different. we won't understand it. We won't be able to address
Hmm.
it if we never actually know what we're looking for or what to expect.
Right. I,
Mhm.
I want all the women that's listening. And I know we have men listening too, but this is for the women. All the women that's listening to this podcast or looking at this podcast right now, put it on pause. Go and get a mirror and look at your womanhood. I
Yeah,
mean, I bet a lot of women would say if we took a poll, like I've seen it only once or twice, because
right.
it's just not one of those things that we desire, I guess, to look at. But it's one of the most beautiful parts of that a woman can have, I believe.
Hmm. It is. And it's a part of us. And uh, what would I be without uh, certain things that make me a woman? I wouldn't be a woman. All of those
Right.
things work together, um, and I'm not saying necessarily one is more important than the other, but God gave it to us for a reason,
Yes,
and
ma'am.
He does want us to take care of it. So when you're talking about taking care of your temple or your body, that's all included. All
Yes, ma'am.
you to take care of each part of us, and we fail, especially
Yeah.
women. Especially women, we are more concerned with taking care of our spouses, our children,
Right.
parents, and there's
Mm-hmm.
a lot of things that we're required to do, but we let ourselves not be taken care of, and that whether that's weekly, whether that's daily,
Mm-hmm.
getting enough rest, not going to the doctor, seeing about ourselves. Um, so whatever it is, not exercising, all of those things really hinder us. And we many times we don't realize it until we're sick and can't take care of other people. So they say on the plane, they tell you to put put your mask on first, and then you help your child or whoever's next to you. You have to have yourself girded up first to be able to take care
Right.
of others. So
If you're not the best for yourself, how can you give the best to others?
you cannot.
That's such a good analogy with the airplane. I hope that women are starting to really see that. We
Right.
put our lives on the back burner for somebody else, and you know
All
what
the
happens to
time.
stuff that's on the back burner?
It
It either
burn up.
burns, yeah, there you go, burn up, disintegrate,
Right.
evaporate, and it's no good
Exactly.
for anybody. So
No
this
good.
is just a friendly reminder that we need to start taking better care of ourselves as
Right.
women. I want
Mhm.
to jump into any misconceptions. Do you come across women in your practice that have misconceptions about just being a woman?
Oh yes. And I think those are culturally based and also of your upbringing. Women many times have lesser position in
Mm,
society, and that carries over into the homes also. And actually, as a woman, you will realize you have the most powerful position.
come on now, come on.
God, when He created Eve, okay, I'm sure she was the most beautiful woman ever made,
Yeah.
created. And she still had influence. She had influence.
Mm,
And but God wants us to use that for good, not
for
to
good.
influence him or our family or our children into things that we shouldn't. But um, he's given us beauty. Whether you think you're
Yes.
beautiful on the outside, you you definitely are beautiful on the inside. And you need to tap into that and realize that you don't let the world
Oh
tell you
man.
you are on the
Come
outside,
on
even on
now.
the outside. God tells you what you are. And he created us as a beautiful, created being,
Yes.
unique, unique,
Yes.
not like another woman, but women in general, we're powerful. And he designed us to use that power to
Mm.
help our mates, to help our
Come on.
mates,
You
to mother
preaching a
our
thing.
children, to
Yes.
be daughters, to be sisters, and be
Yes.
friends. He powered, gave us all that power to do those things. So we shouldn't
Mm.
see ourselves as less. even if
Oh, I
society tells
love
you
it.
so. And
I
society
love it.
will tell you so. Okay.
I love
Oh,
what you're
yes.
saying.
Yes. So you have to see what God created you for. And then
Amen.
you will see with that power comes responsibility.
Yes,
And
ma'am.
um, a responsibility to follow God and his be in his will, also
Yes.
to take care of yourself, also to use that power to influence your spouse, family, whatever, in the right direction. And we know in healthcare that women are the driving force of healthcare.
Yeah, that is
Many
so true.
times, males won't go see a doctor unless they're pushed
Mm-mm.
by a woman. Your
Mm-hmm.
children are taken to the doctor by a woman.
A woman.
So we have, we drive those things, okay? And that's not about being head of the family. It's about
Right.
knowing your position in the
Oh, I
family.
love it. I
It's about
love
your
what you're saying.
position in the
You
family.
you you
Yes.
preaching over there, Dr. Lisa. But it's so true because
Yeah.
some of us don't know our power, and you're so right.
Right.
We're the ones that's taking care of everyone, making sure that they are taken care of,
Yes.
making our husband's appointment. And I will
Yes.
attest, if it wasn't for me, my husband would not go to the doctor. He colonoscopy. Oh yeah, you going to
Yes.
get your colonoscopy.
Right.
Prostate. Oh yeah, you're going to get that
Yeah.
too. You know, I'm
Yes.
like have a checklist of everything he needs to get
Exactly.
at the time. But in order for me to do that, I need to take care of myself too, and I just make
Exactly.
sure that that I take care of myself as well as I take care of
Yes.
him.
And you have a checklist, making
Yes,
sure that your things are done. Your annual exam, your mammogram, whatever it needs, at whatever point in time, your colonoscopy. All of
right,
those things that that would try to it's it's preventive, yes. It's trying to
mm-hmm,
get you not to have certain diseases.
right.
But it's also to find out if you have certain diseases, find them early when they're treatable, when you can
Yes,
take
ma'am.
care of them. That's what that's for. Your preventative annual maintenance, that is what it's for.
So let me ask you this: Are there standards? Because you started naming some of the things,
Hmm.
the exams. What are the standard exams that all women, regardless of your age, all women should be having checked, or are the exams that we need to have?
Yes. In particular, really, you really need a primary doctor,
Okay,
whether that's family medicine, internal medicine, whatever, you need a primary doctor. In this day and age, your obstetrician gynecologist is not your primary. We don't get paid
right,
to do all the primary things, and we people have so many gynecologic problems that we don't have time, you know,
right.
to take care of that.
Mhm.
And also, all of medicine has become so specialized that each specialty just really tries to stay up to date in their area.
In their
So that's
area.
another thing you want. You
Mhm.
want I don't have to know um I want to say per se how to treat your upper respiratory tract infection. That's your
Yeah.
primary to do. So, or your colds, your flus, and things like that.
Mhm.
I may know, but that's not what you're
Your
coming to see
area.
me for. You want
Right.
me to know about your problems and with your women's health, and that's what we do. Many times we were your primary because people wouldn't go to
Right.
their primary doctors. We just don't have that luxury anymore, the way medicine has
Met.
come about. So that's the first thing. Then your gynecologist, you wanted to have, in general, an annual visit. Now,
Okay.
most of the time, since we don't even start pap smears until you're 21, so most of the time, up until that age, you're not really seeing the gynecologist unless you have a problem uh,
Mhm.
with your periods, heavy bleeding, or just things of
Mhm.
that sort, um, severe cramps. And many times the primary doctor will take care of that, or the pediatrician will take care of that up to a certain point with our young
Okay.
people. But by the time they're 21, they should see us. Many people will bring their teenagers to see us before they go off to college or something like that
Okay.
to prepare them and things
Yes.
that sort. But at 21 is where we start pap smears. Um, there are recommendations
Okay.
that with the pap smear, you get it at least every 2 to 3 years. And that's as long as they've been negative and there hasn't been changes in your life or your health condition.
Okay.
Now, that's in general. And we also do HPV testing, which has been implicated or very much so implicated. We think essentially all cases of cervical cancer come from HPV.
H-
So
okay.
that's a important testing that you do along with the pap smear. Now, people need to know that pap smear is a particular test. It's a test or screening test
Mm-hmm.
for cervical cancer. It is not equal to your annual exam. It is not your annual exam.
Okay.
There's people who don't even need a pap smear, but they get their annual exam. They're getting checked. Their
So that's
women
two
are,
different things.
it's two different things.
Okay.
Annual exam are things that we check off yearly, like your breast exam, your pelvic exam,
Right.
things like that. So when they recommend that the pap smear be done every 2 to 3 years, that doesn't necessarily mean you only go to the doctor every 2 to 3 years. That's just
Right.
one portion of your annual exam. So in
Okay.
general, annual will mean once yearly, okay, whether you're
Mm-hmm.
doing the pap smear or not. And then by the time we reach a certain age and we uh, start to have Medicare as our primary insurance, Medicare only allows an annual exam every 2 years. Yeah, so between 65 and 70, we say every 2 years is generally enough. But still getting your yearly mammograms and things of that sort. Also, we recommend mammograms, but we don't start them
Yeah.
until about age 40 unless you have a family history where
Okay. That's good
we
to
need
know.
to move it up. Yes.
Mm-hmm.
But before that, you can do self breast exam. Most
Right.
people in that I see, many of them find their own breast cancers.
Isn't
And
that
that's because,
incredible?
yes, they
Mm-hmm.
know their breast, they found something different. And you don't have to be an expert at checking breasts. That's what you leave me to do. But
Right.
you should be an expert in your own or checking your
Mm.
own breast so that you know when something comes up that's different, that's odd, that can't be explained.
Mm-hmm.
Um, so usually you will find things well before you see me once a year
That's
because you're
good to
checking
know.
monthly.
Right.
So self-breast exams, getting exams, seeing your primary, even if you don't have medical problems, you still see your primary at
You
least once
still
a year.
need to do it.
Yes, yes. And it can keep you from a lot of things. And if you're like me that we have a lot of medical problems in our family. And
Mm-hmm.
my doctor was watching me until I developed them. And
Right.
some of these things we're going to run into because they run
Yes.
in our family. And we can do the best we can to try to avoid getting them, but sometimes we do anyway. But
Right.
she jumped on it as soon as that started to change. And she got me together. So things are controlled. Um, and that's just what I
Yeah.
had to live with. That's the family I was born to.
Uh-huh. We all have something, right?
Right, right. So those are,
But
and I can do better in controlling them too. You just have to be mindful of it. Just
so it
mindful.
sounds like you know what you're saying is when you're able to do all the exams that is necessary,
Hmm.
you're staying abreast of what's going on with your body. There's
Yes,
times that you can either not so much prevent, but you're proactively
right.
monitoring your body. Therefore,
Hmm.
when you uh, go to see you can say, "Hey, Dr. Lisa, I felt this lump in my breast, or I
Yeah,
see something down here," because you have already taking care of your temple in a way.
Right.
And we're
Exactly.
leaving the other information, like gathering the information, what we need to do, our next steps from the experts like such as yourself.
Hmm. And also, when you do find something, don't wait for your annual exam. Come in and see us. We're
Right.
Most of our visits are not annual exams. They're problem visits. So people have
Oh,
problems
really? Okay.
well in
Okay.
between their annual visits. So you come in then. A lot of people, one of my biggest pet peeves is people after menopause who have bleeding. Well, I bled a little bit and blah blah. No, that is that is not normal. It needs
Yeah.
to be checked out. You cannot wait till your annual visit. You can, and especially if you're on Medicare, where it's 2 years between your annual exam, you have to come in for a problem visit. Medicare
Right.
just says you only get an annual every 2 years, but any problem visit, you need to be seen. They know that, and they
Right.
generally cover that. So those things that you find or that you question, go and see the doctor about.
Right.
And are we right 100% of the time? No. But most often we are,
Y-
as we work it up and find out what's
Right.
going on. Also, Google. Okay? I
Yes.
love I love
Yes.
Google. I can find things quickly on Google,
Mhm.
but I do not let Google diagnose me.
I was going to ask that. Do you
Yes.
find a lot of people
Oh,
self-diagnosing,
oh,
you
yeah.
know,
All the time.
to the
And
extreme?
to the extreme. And and I'm not saying that Google is not helpful in many cases on many things. Of course it is, but it's that information that Google has been put there by someone.
Right.
I'm saying, is that someone qualified at
Mm.
all to tell you what's going on? I'm
That's
sure I can see
good.
something out there and about mechanics or taking
Right.
care of a car, which I know nothing about. It's just
Uh-huh.
my experience. Oh, I've had a bad experience, so I want to put something out there. No, no, you want a qualified
Yeah.
uh,
Expert.
resource, yes.
Yes.
And you can do that with things like Cleveland Clinic, Mayo Clinic, all of these things that takes you to a trusted website where
Yes.
people have to pass a certain bar to be able to put stuff on their page.
Oh, that's
Okay?
good to know
Oh,
that,
yeah. Yes.
because it
So,
it can be overwhelming when
yes.
they're like, oh, I got a lump, and they're doing all this Google searching.
Yes.
They come self-diagnose with, I got cancer, and it turned
That's
out
the
to be a
first
little
thing it tells
pimple.
you.
You know what
Right.
I mean? All you had was a little pimple, or where your bra was rubbing up against your breast, but you have
Yeah.
diagnosed yourself as having cancer. So
Oh my
what you're
God.
saying
Yes.
is, listen,
Right.
ladies, if you're listening to this, go get checked by an expert.
Go
It's
get
good to
checked.
know your
Yes.
body. It's good to be able to see things and see changes, but you need an expert to help you out and
Hmm.
navigate these
You do.
changes in your body.
You do. You do.
You mentioned something that I want to dive into.
Okay.
You mentioned menopause.
Yes.
Growing up, that phrase, I don't remember that much. I remember the
Okay.
ladies would say, "Oh, and it was like a secret. Oh,
Yes.
they going to the through the change of life. They going through the change of life." And I'm like,
Yes.
where are they going? Where is the destination?
Where they
What's
change
going
into?
on? Is she going to the change of life? What is that all about? Is it a party?
Yeah.
What is it? Because
Yes.
we didn't talk about that much, and it was
Hmm.
always, when you heard it, like it was in a negative connotation. Oh,
Oh yeah.
they go. That's why she acting like that. She going through the change of life. But it shouldn't be that we look at the
No.
changes of life, or menopause or perimenopause, in such a way. I recently had a conversation with a young man who
Mhm.
was worried that his wife was going through perimenopause. Now, I'm no expert at all, but he said, "Well, what can you get?" I said, "Listen, you need to sit and talk with her doctors. You need to listen to what this woman is saying to you
Mhm.
about her body changing,
Yes.
and just listen, and then do some research." I love a informed spouse,
Yes.
somebody that can recognize that something is different is happening in their wise bodies, and they're not
Hmm.
just ignoring it or just not just saying, "Oh, it's her time of the month," but they're informing themselves so they know how to better address these issues with their wives or their partners. Um, what is menopause? What is
Okay.
menopause?
We actually define menopause as the stopping of your period for at least a year.
Okay.
And that's age related, not
Okay.
not you're 20 and you missed your period for a year. That's not normal either. But at a certain age, we do expect that. Um, and we define it by a year, but is everybody's certainly perfect? Some people's might be 13 months or whatever, but a year is usually the definition. And and it's not even just periods. We're talking about stop seeing blood for a year. Okay.
Okay. Any
Spotting,
signs of
spotting,
spots? Okay.
anything. So you many times that can be accompanied by hot flashes, which is like
Mm-hmm.
a flush that takes
Yes.
over your body, just heat, usually from the chest on up. But it can occur down my arms. I can
Uh-huh.
feel sweat in the creases of my arms. It just can be anywhere, but usually from here up. Hot
You
flush.
know what can I stop you on that?
Yeah.
I always say when women that's going through menopause who experience those hot flashes should be
Hmm.
some of the best human beings on earth. Y'all don't want to go to hell if you can't you
You can't
can't
take
deal
hot
with
flash.
the hot flashes. I'm telling you,
Right.
the hot flashes are real.
They are real.
Okay.
And the inner heat, and it can spark moodiness, anger,
Yeah.
any of those things. It's basically just fluctuations in your hormones that set off these things. And
Mm-hmm.
hot flashes are not at night. We call them night sweats. And
Yes.
some people sweat to more degrees than others.
Mm-hmm.
Um, some of the other changes that can go along with menopause is dryness in our skin,
Yeah.
dryness in the vaginal area. Um, all of those things, it comes from estrogen decreasing. So
Okay.
then you get to really find out, what does estrogen do for our body.
Yes.
When you
Yes. You appreciate it.
yes, when you start to be without it, you know. Trouble sleeping.
Hmm.
Sometimes people have trouble sleeping just because they're having too many night sweats, cover
Right.
on, cover off, just not a restful sleep. Also,
Fan on, fan off.
fan on, fan off.
Yes.
And also just insomnia, difficulty sleeping. So some of those are just some of the changes. Not everybody has the same symptoms. Some
Okay.
people have no symptoms. I think it's genetics. I always say it's genetics, but
Really? Okay.
it's probably more familial in this family. We just don't even
Uh-huh.
maybe you don't have those symptoms. I was ready for them because my mom had them
Yes.
terribly
Yes.
from a young age on. I know she was uh, definitely having them by her 40s. I think even before her 40s.
Really?
Yes, and I had them terribly before 40 also. So for many, many years, I've had those symptoms. There are things that you can treat the symptoms of menopause. But
Okay.
menopause really is a stage of life. It's the
Right.
stage after your reproductive stage. In that reproductive stage, I can have babies or whatever.
Right.
But after menopause, that time has passed. So when people say, well, I haven't got there yet, no, you're in there. And
Yeah.
you're in there for the rest of your life until we leave this earth. You're in your menopausal stage. But
For the rest of your life, you'll be in this
yes,
menopausal stage.
yes.
Okay.
Hmm.
Okay.
And then perimenopause is that time around menopause where you're just trying to get there, I would
Uh-huh.
say. You're probably having more symptoms. You might be skipping your periods, things like that. Though it and your hormones are fluctuating, but you're just not there yet. That's
Right.
perimenopause.
Right.
That's perimenopause.
So
Yes.
what are some of the treatments for this? Should everybody just run and get on hormone replacements, or what are some of the treatments for this?
No, not really. And also this has become a big topic because certain people have or bring it up now, so now it's okay to talk about. But this is the same thing your parents went through. Your
Right.
mom, if she lived long enough, she went through this too. They
Nothing new
didn't
under the
they
sun.
right, they didn't die from this. They didn't
Right.
have to go to a mental institution from this, whatever you have about it. Your parents went through this and they
They
survived.
survived.
And we
Right.
will too. We will too. So,
Hmm.
but I know at this time in our lives, we want to survive it more comfortably. So
Right.
maybe everybody doesn't want to deal with menopause or symptoms like hot flashes, night sweats, vaginal dryness.
Right.
Some things will come that you can't overcome, but you can make them better, like hot flashes and night sweats. The first thing I tell people is to assess your diet and your habits. Uh, sugar. Sugar is
Sugar
like,
affects
oh
hot
yeah,
flashes.
it makes them terrible. And that's hard to tell to a person who loves chocolate like me. But
Oh yes,
definitely,
yes.
definitely, sugar is the number one enemy in hot flashes. But
I
it's the
never knew
number one
that.
enemy in a lot of things. If
Okay.
you don't want to be diabetic, if you don't want to be
Right.
overweight, if you don't want to be this or that, sugar adds to all of that. Um, Alcohol and caffeine, those are other things that set off hot flashes and night sweats. And
Okay.
then you also try to assess when does mine occur? Um, Mine occurs when I'm rushing around. So
Okay.
if I need to jump in the shower, jump out, I may be just because I'm rushing, my hot flash may be so bad I can't even put on makeup because I'm sweating.
Yes.
So
Right.
you kind of want to see what are your behaviors that would make this worse.
So
And
monitor
look,
your
yeah,
monitor your behaviors and see
mm-hmm,
what's, and then you're talking about also like the time of the day, because that could
yeah,
also play into why we're hot flashing
yeah. Mine's is at 5 a.m. every morning,
every
It-
morning.
or
Yeah.
or
Yeah.
between 3 and 5, depending on what I had. So you can kind of or if I know we had a small birthday party last night and I had a lot of sugar, I know it's coming.
It's
I know
coming.
it's coming overnight. So you just have to monitor what sets them off for you and how
Okay.
you can minimize them. Also, there's over-the-counter supplements that may help. They're not medications, but they're supplements. Black cohosh is one.
Okay. Yes.
Um, I don't recommend a lot of soy products for people, but if you don't have problems with obesity and things like that, soy products work good. Even some people do yams. Yams help because they can be estrogen like. Um, so
Okay. Now I
many
never
over.
heard of that before.
Mhm. Yeah, those are
The yams.
yeah, some people if you like them, it
I
helps.
love them.
Yeah, so
Yeah.
sometimes that
Okay.
can be helpful. But how many can you eat to help?
Mhm.
That's the problem.
Mhm.
Um, Also, there's some that are formulated in a way so that you can get more, like say the things that come from yams, you can get more of those maybe in a capsule. I don't know.
Okay.
I may just say some names like it used to be menopause, estrogen, things like that,
Okay.
over the
Yes.
counter that are
Mhm.
packaged to help. There's a lot online. Um, I can't attest to all of them. Um, Bonafide makes one called Thermella. Um, O Positive makes one. They have a whole line of products, and they
And these
have
are
hot flashes and night sweat. Yes,
over the counter
yes, oh
medications.
yes,
All
they're
of
over the
those.
counter. Yes,
Okay, so there are
yeah,
remedies, and then
are remedies. Yes.
and you also mentioned some like supplements that you can
Hmm.
take. So
Those are
you know,
supplements, and they're over the counter also.
So
When
should
you
we be
start,
talking to our doctors before we take these, or should we try them
many
out?
many times, especially if you have any medical illnesses that you're being treated for,
Mm-hmm.
I would talk to my doctor first because
Okay.
I trust her. She's gonna work with me through this,
Right.
and I usually run things by her first,
That's
and that's
smart.
for me because of whatever medical illness I have. I want to make sure I'm not doing anything counterproductive. So I do talk to mine, and I'm a
That's
GYN,
smart.
but I talk to her.
Okay.
Um, Also, there are other things that sometimes, if you speak to your gynecologist about, or your primary. Sometimes the primary treats these, but there's something that they can try even before replacing the hormones to
Okay.
see if you could sleep, help you just
Right.
chill out on the hot flashes. Another supplement that's helped some people is vitamin E twice a day. It helps
Nah,
maybe
I
chill out
heard that.
and
Mm-hmm.
hot flashes. So there's many things that you can try, like you said, especially if you have medical problems, talk to your primary doctor first or your
Okay.
gynecologist and see. And then when those things don't work, then we generally will move on to hormones if some of the other non-hormonal options that we have work, don't work, then we can move to hormones. Um, just remember everything they show on TV, your insurance might not cover. Uh,
Okay. That's good that
yeah,
you said that because some
yes.
things can be very expensive.
Very expensive. And um, there's one, I know it works. It's called Vioza. That's for hot flashes. It's
Mm-hmm.
non-hormonal, but you don't know. You're supposed to have your liver functions tested before you start that. Okay.
Okay.
And it's only a prescription. And uh, many times, if you haven't tried multiple other things, your insurance won't cover it. So, you know,
Okay. So they want to see
we,
a history of you
yes,
trying other things prior to
yes,
being on that. Okay.
exactly. So there's multiple options. Just talk to your doctor about it. There's no one pill for everybody.
Right. No
There is
one size
none.
fit all.
There
Okay.
is not. And um, also, I find it people are very skeptical about trying hormones. If we talk to
Mm-hmm.
them about it, they're scared, which they do need to be regulated.
Yes.
Um, but people will go and get pellets put in there. Those are hormones. So it's just,
Oh, okay. I see what you're saying.
yeah, they'll go get their levels checked and then get these pellets put in. Well, we don't want to treat lab numbers, number one. We want to
Okay.
treat people, okay? And
Oh,
we want
can
to
you say
treat,
that again?
yes, we
I
don't
like
want
how
to,
you say that. Yeah.
yeah, the labs are helpful in our diagnosis, but we don't just want to treat numbers. I want to treat you. I may have
Oh,
two women that come in and one, they may both have um, low estrogen levels. Well, I expect them to because they're both menopausal, but one doesn't have those symptoms.
right.
I'm not going to give her anything if she doesn't
Mm-hmm.
have the symptoms. If this one has symptoms, then I want to give them something, but I want to give them just enough to help what symptoms they're
Yes.
having, not where I'm trying to get them a certain lab level on
Right.
estrogen. Hmm.
Because it's still a stage that you have to go through, regardless of like what medications you may be on, what
Yeah,
diet. It's still something that our bodies will
it's
forever be
going to go.
transitioning in. It sounds like.
Exactly. Exactly. And and also we're not the only ones that have a transition. We just
Yeah.
don't call it
Yeah.
menopause in men, but they have changes themselves.
Okay.
We're just more accepting of their changes
And
than
I
they
wonder
are.
why is that? Our changes are labeled. We
Yes.
label our
Yes.
changes. We don't embrace them.
Right.
Even when you're talking about the starting your cycle, we didn't. Hey,
Right.
her aunt came. I'm like, her aunt came. I thought she only had uncles, but you know what I mean.
Right.
We use these euphemisms
Yes.
to
Yes,
kind of
yes.
say what we really need to say. Now her aunt, where's she go to?
Oh my goodness.
And so now that
Right.
we're, my audience are more mature women.
Right.
And
Right.
I don't discriminate. I want all the women to be on this podcast, but I
Right.
know my demographics, right?
Right.
And so
Exactly.
we need to start talking the language that our practitioners are talking. We ain't
Right.
talking about, the changes. We talking about menopause. Call it for
Menopause.
what it is so you can be able to embrace it and
Yeah.
and treat it and do what you need to do in this stage of your life.
Exactly. There's things for vaginal dryness.
Hmm.
For many women, now I would recommend even before you see your gynecologist, even while you're waiting to see your gynecologist, try vaginal moisturizers. They're over the
Okay.
counter, but there's something to be used regularly. I can't just
Okay.
take. It's not to be used just before sex. That's
Hmm.
lubricant. That's a lubricant. If you need lubricant to help some of the dryness or discomfort you
Hmm.
might feel during sex, that's
Now we ain't
lubricant.
talking about Vaseline. We talking
We're
about
not talking
what you
about
really need to
Vaseline.
be using, ladies. We ain't talking about no petroleum jelly,
Right.
cocoa butter smelling. We talking about
Yes.
use what you
Yes.
need to
Now,
use.
now, some things you can for lubricant. You can use like KY jelly and things like that,
Hmm.
but also sometimes coconut oil, some natural type things
Oh,
might be
okay,
helpful. That's for a lubricant, and that helps.
okay,
That means that a lubricant is for that time. It's not lasting. Okay. With
okay,
the moisturizers, you're trying to add moisture back to the vagina so that sex is not uncomfortable. Also, it's not just for sexual things. It's for active women who they walk, they fast walk for
okay.
exercise. You might start to feel some discomfort, like as things rub together or whatever. It that can be from
Hmm.
dryness. If you ride
Okay.
the bike, my Peloton bike, you might feel something on that hard seat. It's just a little uncomfortable.
You're teaching me
Also,
something because I wouldn't. I
yes,
just always associated the dryness with when you're
with sex,
intimate with your, I'm say your husband
spouse, yeah,
or
right,
or your
yeah,
partner,
and
but that's
more,
what I always associated with. I didn't
mhm,
realize that there could be dryness during another time other than intimacy. But
right, and
there
you can
there
feel it
there
another
is.
time.
Okay.
And another thing, people that those changes in the vagina makes it make you more susceptible to urinary tract infections or bladder infections.
Wow.
Also to bacterial infections or yeast infections, because people always come in and they might have them recurrent. They say, "Well, I'm not even sexually active," but there's changes in your vagina that
Okay.
that's a setup for that. And those things aren't necessarily sexually transmitted anyway, but
Right.
this setting you up for that. And when we send people to the urologist about recurrent urinary tract infections, guess what? My ladies always come back on estrogen. The urologist tell them,
Really?
yes, they tell them you need estrogen in your vagina. And that is a
Hmm.
local therapy. That's not like you taking estrogen all over your body by mouth, by pellets, by
Okay.
patches, or anything like that. This goes directly in that type of estrogen goes directly in your vagina just to
Like a
help
suppositor or something like
or
that?
cream. Yes,
A
a
cream?
compensatory or
Okay.
cream, and it treats the vaginal lining or the vaginal walls. And just in doing that, it helps the other tissues too that goes from the bladder to the outside. We call that the urethra. It helps with that. It helps a lot of things in that area. So we don't just
Wow.
use it for sexual intimacy, we use it for health.
Well,
They'll
Dr.
call it
Lisa, you
sexual health.
you're you're educating me because I just
Yes.
assume I always just assumed that that's what it was, for when you want to be intimate. I had no idea that you could experience that, during. And this is why I
Hmm.
think, with this podcast and with any kind of podcast related to women's health and women's care, it's so important
Hmm.
for us to have these conversations
It
because
is. It is.
if I'm saying I didn't know that this was, a thing.
Right.
I only thought it was there a situation, if you will,
Right.
during the intimate
Good
areas of
time.
your
Yeah.
life,
Hmm.
I feel like we need to be talking about this more
Yes,
instead
we
of
do.
allowing this kind of information just to sit or sit in the
Hmm.
experts, and the experts may not be always relaying those messages
Right.
to the
Or
women.
they might not be in tune with what you need. And it's okay to talk to other people about it too.
Yeah.
Um, God has shown us that the older women need to teach the younger women, but we have to be wise about what we're teaching
Yes.
and preparing them. But however, you got to remember also that everybody's situation is not the same. And that's
Yes.
why I'm a little bit of leery of some of the products that they sell online. Like if they sell estrogen online, I didn't know they did, but I guess they do. But
Oh,
if
they
they
selling
sell,
everything online
yeah,
now.
you have to be careful because if that estrogen is the kind that goes all over your body and you still have a uterus, you need something to counteract that. That's not the same as a person who's had a hysterectomy. You're That's why you need to talk to your doctor along um, with your decision to try something because they will tell you what you need in it.
Right.
And I'm not going to know what's in every product that you bring me, but I will tell you if you're using, say, you're going to use estrogen, well, that seems to be a safe option for
Mhm.
you, or it's not a safe option for you. Just
Mhm.
things like that. That's why you need your physician's uh, counsel when you
You
on.
know, we need to be reminded when you have a good doctor too. I always tell people, if you're not satisfied with the service that you're getting, seek seek
Another service.
counsel
Yeah,
somewhere else. You know what I
that's
mean?
right.
Because
That's
you're
right.
paying for it, so you
Exactly.
find a gynecologist that's going to give you their time, not just like you said. You're not numbers. You're a human
That's
being.
exactly right.
And whenever you feel like you're being treated as a number, then you may have to have a conversation with your doctor. And if that conversation doesn't work, you may need
Then
to find someone new, because I feel like your
exactly.
doctors are your partners.
Sure.
And if you have a good one, you're going to be with that person for a long time.
You can, yes. If you
It,
can, you really would choose to stay with them. I know insurances change, jobs change, but you would wish to stay with that doctor who's really meeting your needs. But also to help yourselves in these visits, have your questions written down.
have your questions.
Have your questions. Because when we
Yeah.
come in and I give you that form, you say nothing's wrong on that form, I think we're I think we're gravy. Everything's good.
Right.
But no, have your questions. Don't wait till I'm walking out the door. Oh, did you see that? Yeah, I heard. No, I didn't see the bump. Where is it? Maybe show me somewhere that I can't just see that on a regular exam. Come in, start talking about when you go down there, I want you to see a bump. Before you look in, I have a discharge. All of those things,
Right.
get them prepared so they can handle what you came in for. We can't guess what's wrong with every person. We see
Absolutely.
a lot of patients in a week, and if I had to guess with each one, I would just
You
pass out.
can.
I couldn't do.
Right.
And so come in with your complaints. And when I say complaints, I mean like what's going on with your body and
Right.
tell them so they can address it. You don't want to leave this year's visit with the same bump and you don't know what it is.
And
So,
wait until next year to address it.
yeah, so just come in, help yourselves. You need to be proactive yourselves.
Be proactive yourself. Be your own best advocate. Sometimes some of
Exactly.
us are so afraid, and again, I know you said some things are cultural, some things, we put a stigma on, but
Right,
you have to be comfortable enough to have these conversations with your doctor,
right.
or else how will you be healed from whatever is ailing you? How will you be whole?
Exactly. And that goes with all your doctors, not just your
Yes, ma'am.
gynecologist. And that's the way you can best be served. So,
Best be served. Dr. Lisa, you are a wealth of knowledge. I could be
well,
on this podcast with you just forever. Let me ask you this: if you could leave our audience, mainly women,
mhm.
with one word of advice that's going to help them through the transitions of life, dropped a lot of wisdom. What would that be?
Um, I pretty much see like, and if we just say we were talking about menopause, I see that as a different stage of life, as it was when I transferred from adolescence to to being a
Yeah.
teenager, when I changed from teenager to being a young adult. Uh,
Yes.
all along, these things are happening to us.
Right.
When you were 30, things start to maybe go south a little bit. Things don't fit how it used to fit. Things like that. Those are stages that are going to come, but it is an absolute blessing to reach those stages.
Ooh, yes.
Many people.
Yes.
So for me, I use God as my guide to take me into whatever stage. God, what do you want of me? What do you want me to do in
Hey,
this
that's
stage
good.
of my life? Where do you want me to be?
Yeah.
And then anything he calls you to do, he equips you to do.
Oh,
So
wow.
so that's how I move from
Saying the
one
word over there.
another. Yeah, just from one stage to another in life. And I know some people are sad to get to menopause. I was quite happy to get to menopause. It
Amen.
just,
Mm-hmm.
for me
Me
in
too.
particular, number one, those periods were gone. Hallelujah.
Yes.
And
Yes.
and they did serve a purpose. And now that time is over, don't need them anymore. Thank God I got through
Yeah.
that
Yeah.
stage in my life to another stage of life where things are I want to say somewhat quieting down. A lot of
Right.
times if you're my age, your children are grown and you probably have grandchildren. And and that's a blessing, to not always be parenting, to get to
Right.
be a grandparent. All of those things come along with it. It doesn't have to be a bad stage in your life. Generally, your spouse is going to be going through some of those changes too. They're not trying to
Yes.
have babies, so I don't need
Right.
that.
Uh-huh.
But there's a time you can be intimate and enjoy each other without the worry of getting pregnant, without the worry of everybody else
Mm-hmm.
being around.
Mm-hmm.
Just the time to be able to enjoy each other. So you want to preserve, especially your sexual functions and things like that. You want to preserve that so you can enjoy each other. However, many times it's not just women. Men might have medical problems that they can't be involved with you that way. So
Right.
it's 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 so important that both of you are seeking God, and many times
Mm.
he sends you help to help you get through
Yeah.
those transitions. Like, if I just find myself out of control, moody, or
Right.
whatever, this
Right.
okay, well, that's why the doctor's over there for you to talk to see what you can do about
Yes.
it, because that affects your relationship. It just, everything affects each other. So you just want to take care of it the best you can. And it should be
Mm-hmm.
an accomplished time in your life when you're in menopause.
Oh, yeah. I like that word.
Yes, it is. You've had your children. You've raised your children. Now you got
Wow.
grandkids. You're proud of that. I'm not saying boastful. I'm just talking about proud of that, of what
Right.
you accomplished. You're happy. You're proud of the things God has blessed you with. Now you want to do those things. So it's an accomplished time in your life. It's
Accomplished
not
time
it's
of
not
life.
it's not the end of life. People are living a long time.
Absolutely.
And if
I
you
don't
go
think
more,
I've.
yeah, if you go through menopause at 50 and you're going to
Right.
live to 80, 90, look, that's 40 years of your life. You're
Yeah.
going
So
to
you
spend at
might as well
menopause. Yes.
embrace it.
So
I
it's,
love the
yeah,
accomplished part. What you said about
yes,
that. I never heard
accomplished
it
part.
put. I never heard it put that way. That's the
Yes,
accomplished time in your
yes,
life, and you should
yes.
be able to embrace it.
You should be able to embrace it. And many times you might even be on the road to retirement. That's a wonderful time, and frees you up to do something else. Some people
Right.
pick up another profession or whatever, but it's a time for, usually you can look back over your life and just be thankful for what you've been
Right.
given and what you've accomplished. And so it is not. a end of life thing. I don't know. We kind
Right.
of talk about it with such negative connotation, and it's not.
Yes.
It was
Yes.
designed um, for just a different function in your life. I don't know what
See,
God's
that's
calling you to do at that
wow.
time, but you were designed for that at this time. At
That's
this
why
time.
I love women who are so
Yeah.
much wiser than I am. You know, you could put things so eloquently, and now I feel like I am at an accomplished part of
Yes.
my life and on my
Yes.
journey, and I feel like I
Exactly.
can go on. And so, but
Exactly.
we need to hear
Yes.
those words. We need to be able to
Yes.
encourage ourselves first,
Right.
and know that wherever we are on our
Mm-hmm.
journey in life,
Yeah.
it's a beautiful thing. It's a beautiful thing because you're living and you're breathing and you're
Mm-hmm.
moving, you know. So I love what you said. It's an accomplished part of our lives.
Yeah.
Let's embrace it. Let's make it beautiful.
Just
Let's
make
make
it
it what we
beautiful.
want it to be.
Right. And just like how long ago did you start this podcast?
Just in December.
Okay. So, but this is not something you did when you were 30. This is something that you can
Mm,
actually do now. You have so much more knowledge, so
yes.
much more abilities. It was designed for this time. It wasn't designed for you in your 30s.
Come on, preach over there. Preach over there,
So,
Dr. Lisa.
so you see what I'm saying? Stuff
You're
that he's
putting chills
calling you to
on.
do.
Yeah, I'm getting chills
Yeah,
just hearing you saying that.
yeah.
Because
So
sometimes we want things when we want them, and God
exactly
is saying it's
me.
not your time,
It's not your time. It's not
but
your time.
now is the time. Oh wow,
Exactly.
yeah. You
Exactly.
you have took us to church today. You have took us to
Just
your practice. You made us feel like honestly encouraged by where we are in our life's journey. I
Mhm.
feel I do, and I said that jokingly, but I do feel encouraged because
Good.
of the words that the wisdom that you have dropped today. And
Amen.
I hope the Woman Up Nation and everyone is listening and looking at this podcast and they got these wise words from Dr. Lisa Cardwell. Know that this is a beautiful part of your life.
It is. It
Just
really
just
can be. It can be. It's
it can
different.
be,
It's
yeah.
different when you get older. You might not be able to do the same things you could do before. You might be able to do the same things, but slower, or it takes longer.
Yes,
Who knows?
yes.
But still, it's a good time in your life.
It's
It's
a
a great time. Great
Cause
time.
you're,
Hmm.
yeah.
Great
Dr.
time.
Lisa, thank you so
Yes.
much. I hope this is the first of many because it's just so many women, even in my stage of life, that
Mhm.
learned some things that I never knew. I feel that we need to do this more often. Just have these candid conversations
Right.
amongst women to know that, I like what you said. What you said that what we are going through, our foremothers have already experienced,
They
and
did.
they survived.
They sure
So,
did.
so will we. So
We
will
will.
we.
We will.
Well, you
That-
again, thank you so much for joining us on the Woman Up Nation, where we're here to elevate, educate, and empower women to walk in purpose, live in passion, and operate in power. Detroit is privileged to have you
Thank
working
you.
in the metropolitan area and just bringing a sense of joy to us wherever we are in life. Dr. Lisa, thank you so much.
And thank you again for having me.
Yes, ma'am. I'm privileged, and we all are privileged to have had you on this podcast today. You have
Oh,
a beautiful rest of your day, okay?